It's a huge accomplishment for a single service designer now building a team.
Deliverables as a service designer are not defined, and it's only when you do and show you sort of buy in that
I
confidence.
just want to become a product manager.
Hey guys, I'm Junaiza Niazi, author of Navigating Service Design, and joining me is the incredible Sharan Longani, an aspiring service designer. Together, we're on a mission to connect you with the brightest minds practicing service design. In today's musing, we have Nupoor Rajkumar. She's practicing service design in India. She's a senior service and systems design lead for Noora Health's global shared programs that works extensively to increase the adoption of health behaviors, example, hand washing. She has been particularly focused on building service design capability across India, Bangladesh, and Indonesia. Thank you, Nupur, for joining us.
Hi, thanks so much for having me, Janeza and Sharan. Happy to be here.
Noora Health has that. I've read the story of where those three founders came in, brought in that change, and it's one of the main anchor stories for service design itself, right? So, would you say Noora Health is built by service designers?
I would say it's an organization built by, so they basically started at Stanford D School, right?
Yeah.
So they used design thinking. They used human-centered design to essentially start the organization. That being said, service design is not necessarily something that they understood from the perspective of, oh, we have to connect the dots also, like across the
Yeah.
board. We have to think about like the program delivery also, and not just the design of the program, not just the user's experience, but also stakeholder experiences. Once in a while, like it comes directly from them, right? Like, for example, we have I have been asked to design like funder experiences before, which is so completely different from what we usually see, and great. Like the fact that somebody came and said, hey, let's design a funder's experience is awesome. But a lot of it remains about ops and efficiency. The organization has a great employee experience. So even ops and efficiency is great, but it's not necessarily thought about this the way we think about it, which is how does that connect to the patient experience, right? How does that connect to the end user's experience? Like that bridge is not something that they understood before. It's been for almost 4 years now, and I would say the understanding has increased drastically, and continues to get better. But yeah, in the beginning, for the first couple of years, I was definitely running around and saying, hey, this is what I think service design is, and then like sort of getting them to tell me what they think it is, and then like with every member of the leadership team, I had to do all of that work
Yeah.
to have to get more of a foot in the door.
The word service itself is a different perception for different stakeholders based on their experience or their worldview. So from that angle, there was this chapter on the book where I had wrote about what is not service design. So the paragraph goes like this: language sometimes limits the beauty of what we want to express. The moment people hear customers, services, processes, functions, or operations, their imaginations limited to what they know or have associated these words in the past. So, one instance is where I found myself explaining what I do not do while I was working in the EV industry. Because the word service was associated with service centers, whose primary focus is servicing vehicles. And similarly, what I've noticed is that you have worked across various sectors, Nupur, around banking, education, and healthcare. So, what was the word service associated to in these sectors, and what was your challenge like?
Yeah, I think when you ask this question, the first thing that occurs to me is that it was different in each place. But I think that being said, things like healthcare and a restaurant are a lot easier for people to understand. Like I did not come across. I think somewhere in your book, I think it also says that service is associated with seva for
Yeah.
many people. I did not come across those things in terms of like banking, healthcare, and restaurants because we're very used to providing a service, right? Like education is considered a service.
A
Like I
service.
am doing something for you. Um, um, that being said, it was hard to explain it. I mean, because people associate service only with that one thing, that one
Yeah.
interaction that happens, right? Not like what goes on in the backstage, not the fact that everything together is actually the service. Like from when you're ordering food all the way up to billing, and then before you enter the restaurant, when you're leaving the restaurant, like that doesn't, I mean, I'm just taking restaurant as an example, but that doesn't necessarily come across to all of these people. So I don't think the meaning of of the word service is wrong. I think it's limited. It's become a very do and show thing when it comes to explaining what a service designer is versus trying to explain it from scratch, because that's not. I mean, it hasn't worked for me.
So, Nupur, is it safe to say that your deliverables as a service designer are not defined, and it's only when you do and show you sort of buy in that confidence and then are able to actually exercise as a service designer in its
Yeah.
totality?
Yeah, that's what I'm saying. I think at least that's the way it has worked out for me. Like showing that the value has worked out a lot better than explaining it over and over again. That doesn't mean I stop explaining it. I
Yeah.
continue to do that too, but I think it's okay to sometimes like stop explaining or pause explaining and just be like, you know what, give me like a month, I'll come back.
Has there ever been a scenario where you needed that leeway to be able to work with, let's say, the back end people at the back end to be able to show that value? Like, has this show and tell method ever sort of restricted you in a way to be able to show?
In terms of time, yes, like it takes a while to sort of, you know, by the time you show and tell, other things have happened, you know, sometimes, like, so it takes some time to get there. But I've been lucky enough to work with a very design centric organization. As in, Noora Health is extremely like focused on design and is built from design. So, like, there is a foot in the door. Even then, I think uh, people understand design as visual design and product design and stuff like that a lot more easily than they understand service design, right? So, even then, there is some work to be done, there always will be in my mind. Um,
Right.
but but yeah, being in a design mature organization has made it a lot less restrictive. Yeah.
So, how do you go about showing that value and setting the right expectation? Like, what has been your experience like across these 4 years? Have you changed that narrative?
So in terms of showcasing value, I think when I say that, I don't mean like the measuring services, right? Like I
Okay.
don't. That's hard. That's very hard, and I don't think we've cracked it. Like I don't think we've been able to say we've used service design here, and hence there has definitely been greater impact
Okay.
on people like breastfeeding more, for example.
Okay.
That's a really hard thing to do, and I don't think we've done it yet. What I mean is more around like hey, we just created a fantastic patient experience, and there has been like feedback from that experience, some qualitative feedback that tells us through testimonials, through very like ad hoc data, that it has been helpful. And even that is useful in this case, right, for us to jump in more as service designers.
Hmm.
um, Similarly, like I've conducted workshops with people who are medical support executives. They're also employees at Noora, and they are the ones who respond on our digital platform. So we use WhatsApp to essentially send automated messages to patients and their family caregivers to remind them of things to do, taking medication. And in that, we have in that product slash service, in that small part of the larger service, we have a response team, which is the medical support executives, and I've conducted workshops with them. And
Okay.
those workshops were just like trying to get them to think like service designers, because it's like building capability of the delivery team essentially, right? They can be considered the delivery team as well. And they gave me really great feedback from the workshops as well. So having this, like building those relationships and seeing value even amongst the program delivery, or showcasing value like this amongst the program delivery folks as well, all the backstage folks, gives you a bigger foot in the door. So it's all been a bit organic and like step by step, rather than 6 months के लिए we've done this and then we're saying 6 months later we've measured impact and then we're saying that service design is.
So when you approach like a project, do you set qualitative as well as quantitative metrics, or is it mostly qualitative, and how do you go about it?
Both, definitely both. We have a very strong measurement and monitoring and evaluation team. The monitoring and evaluation team sits under the research team, and they ensure that we are evaluating greater impact. Similarly, we have a learning and sharing team that also ensures qualitative feedback is happening regularly. We also have data science, all of that. So we as service designers contribute from the perspective of creating a theory of change. Which might be a tool that you've seen, but essentially looks at behavior across a period of time, behavioral outcomes across a period of time, and what we want to achieve, what you need to do in order to achieve that. It's similar to a logic model for people who don't know. But in that, we also started to incorporate service behaviors. So earlier, being a very like public health focused organization, the only thing they used to think about was we need to increase breastfeeding. We need to increase the behavior of hand washing. We need to increase the behavior of taking medication on time. Like we need to help people take medication on time, right? And those are behaviors that we focused on. But what we did not measure earlier was, are people actually doing things like calling our number to join the digital part of our service? Are people attending the class that we are conducting in a facility, because that's the main part of our program? Are people actually reading the posters? Are nurses actually handing off takeaways that we're giving them, right? Like those are behaviors that we started to add into the theory of change, which is how service design sort of jumped in on this whole qual piece. But while we use quantitative data to make decisions as well, we particularly participate in the collection of qualitative data more.
Okay.
Makes sense. But wouldn't behavioral change take like a while? Like, can you predict if it's going to be like a 3-month thing or?
So it takes forever. We have a lot of data proving that the classes that we run in the facilities, which is what the organization started with, right? So it was before I even joined, the idea for the classes. And we have proof that those classes have increased various things. Like I think there's a certain percentage of reduction, about 70 something percentage of reduction in hospital readmissions thanks to our program. Similarly, there is proof to show that breastfeeding practices have increased, or kangaroo mother care practices have increased. But yeah, I mean, firstly, I would say it's very iterative. Behavior change is also iterative, as much as service designers. Like things change, so you have to keep trying new methods to make it happen. So we, like the program design and development team, which is a part, service design sits within that. And then learning and sharing, a few other teams that focus on regularly improving and getting feedback on the services, so that we can make sure that we're trying to reach behavior change, or trying to make it engaging enough to reach behavior change, because the assumption is that if something is not engaging, is not interesting, people are not going to adopt it. And then there is also a separate research team that evaluates the program regularly. So we've, I think, conducted various research activities like that, that will eventually show more and more that we are improving. And we have a board of directors and a bunch of funders. We won an audacious grant, which is a huge deal, a couple of years ago, I think. or maybe last year. But all of that also means that we have to prove that this behavior change is happening, right? To keep the program running. And yeah, so there is effort being made. I would say the qual work that we do definitely does not 100% show impact, show that behavior has been changed, but we're learning, it's ongoing.
Why is like involving a service designer an afterthought? Is it because our deliverable is not very clear, or is it like people are not able to picture where we would fit in? Are we just a nice to have or a must have?
That's a really good question. I think in terms of tangible outputs, we've gone down a rabbit hole of creating as many possible tangible outputs as possible, right? Like, this project ke liye we'll do ABCD all the way up to like 20 or something. But and I've done that multiple times across the almost 4 years of being in the organization.
Mhm.
But I've realized that doesn't help as much. There are few things that people care about. For example, we do this thing where we make a very concise version of the model, which is basically service model. Essentially refers to what are our interventions. It's a Noora created service design thing. But what is the intervention looking like from a user's point of view, right? User will enter the facility, see this poster, interact with this standee, attend this class. Class is conducted by this nurse, collects takeaway, joins digital service, goes home, uses digital service, asks a question on that, receives response, right? Like that simple. And that is something that people look forward to. They're like, model kahan hai? Give us the model. Like, we need this. We need to show government. We need to understand it. So few things they definitely reach out to the service design team for. This model, we make a version of this model which is we call the trainer's flow. So trainer essentially refers to a health staff, like a nurse, who we train to conduct that session in the facility. And her journey, her experience using our intervention is broken down from her point of view in detail, because we train her and the training team needs to understand what that looks like so that they can train her better, right? So that again is something that they approach us for. They'll be like, where is it, we need to understand. But there are many other things in that list of 20 that they don't care about, right? So I wouldn't say the tangible aspects are 100% important for people to pull service design in. They are little important. Like, some of them work, but a lot of them do not work, at least in our experience. The other thing I'd say is that I do think service design is seen as a nice to have at Noora. And that again is because of this aspect that I was talking about earlier, which is where right now we care most about increasing numbers and spreading information rather than ensuring that information is engaging or ensuring that behavior change is actually happening, because that is the public health goal. And then eventually, like in the next a couple of years, it will be more about engagement again, right? We would have reached a certain number and then we want to be like, okay, wait, like, let's reiterate on this program. Then we'll get pulled in as a must have.
So when things are vague is when you are a must have, and when there is a set process but the feedback loop is shorter,
Yeah.
you're a nice to have.
Yeah.
But that's a natural flow of where we are also like that. When you look at the progression, a service designer's role is a must have during the discovery stage, quite
Exactly.
a bit, where we have to figure out what that research is, how do we scale. But once you have that a working prototype, it's usually transferred to a product manager or a program manager that runs the pilot or scales it up. But then again, since you're very heavy on behavioral change, like it's like training is when do you say training is completed when you've finished your presentation and training content, or if the person who's listened to your content has understood and has been trained? And how do
Yeah.
you measure that completion is not training but actually leveraging that content and essentially using those tips and tricks is considered as a successful training, right? So we
Yeah.
become a must have once I think that behavioral change is not being hit, and we have to still figure out how people can adopt
Yeah.
whatever these assets have been built. And there
Yeah.
is actual a true change, behavioral change. I think that's where we become a must have.
Yeah, I fully agree. I think the only thing though that I've had to struggle with this year is like, okay, how does the job of a service designer shift? Because it's an in-house team, right? Like, so you can't just move on to a new product or a new service or a new program. It's like, if that doesn't exist, then what are you going to do? But as I was saying earlier, and I think Sharon also mentioned, like feedback is definitely something that we jump in more on through this. So even if they are not going to, even if the team is not going to make drastic changes, right? Like right now, because we don't know if behavior change is being hit or not, like you said. Um, there's still value in like collecting feedback and understanding what the service is like over a period of time. So we've become, I think in India we've become a very slow iterative learning sort of team versus Bangladesh and Indonesia, which is like high innovation, like let's create from scratch. But this this journey of a service designer, so to speak, right? Like, I think that is something that I think is important to document now, because it's a new
Yeah.
experience for me also to see this shift in what our role is like, and it's changed after quite a long time. Like India has become like this only in 2023, and I've been
Hmm.
working here from 2020. So yeah,
Yeah. No, even at Jiva, we're figuring out the Darcy. So we keep using the Darcy to figure out, are we at an accountable stage, or
mm,
have has our accountability shifted to us being more consulted and informed, and we pass on that accountability to somebody else. So how do you it's more like a relay. How do you where do you pass the baton, and who do you pass that baton to, and when do you go and pick it up again? I think
yeah,
that is a cycle that we're still figuring out to understand when is that trigger where we pass on and then we bring it back up, because if that trigger is missed, then it creates chaos.
yeah, makes sense.
What is the future of service design looking like at Noora?
I think right now it makes more sense to keep the teams lean. So we'll have a maximum of 4 service designers in India, um, which is ample. In terms of Indonesia and Bangladesh, we'll see. Like in Bangladesh, um, there were no service designers when we were looking for service designers, right? Like it was really hard. And eventually, we've hired a data analyst who's fantastic. Like he's amazing at service design and so good at what he's doing. Indonesia is very different again, because the design maturity of the country is sometimes I feel better than India also. Um,
Okay.
yeah, I mean, we've worked with a fantastic design consultancy called Hume, and they were awesome, very, very like on the same page as a lot of us in India. Now we have somebody who's joined us as the program design and development lead, who is my manager Samina's counterpart in Indonesia. And she is also fantastic. Her name is Chinta. She understands service design so well. And we've hired a new person, a service designer, to work with her and her team as well, who I'm also mentoring. Um,
But it's very interesting that you found the service designer that you identified in Bangladesh to be extremely proactive and excited. But what traits or what skill sets did he have that you feel like he was amazing at doing service design? Because it's such a
yeah,
broad term, and he's a data analyst as well. So, what was that overlap or specific skill set that you personally felt he was really good at?
I think so. One is him, and there's another person also who has an engineering background, worked at like Infosys and Wipro,
Mhm.
like no designer. Um, and I would really say, and then we have like people who worked in math, architecture, public policy, and it's quite diverse. A lot of them have had little to no experience in service design. Some of them have done degrees, but I'd say the lesser people have studied service design, in my experience. The lesser people have actually studied service design from a university. They are like proactive and more like able to sort of meet people where they're at. I don't know. I feel like design school, and I've posted about this on LinkedIn before as like a rant, but I feel like design school, and I have been to one, so I feel like design school sometimes makes you a. I like to call them turtleneck service designers, like Steve Jobs reference, but like I know what works. You know what I mean? Like I think this makes sense. And Apple is a fantastic company, so no qualms there. Like that worked. But for things like public health, you can't think like that. You can't be like, I know what works, right? So that trait of like A, meeting people where they're at, and B, being able to say, which is a part of meeting people where they're at, being able to say, I'm here to sit down with you and learn from you and co create with you, and that's it. Like, I'm only facilitating this thing for you, right? Rather than being like, I'm going to journey map separately in like a glass room, and then I'll come back and give this to you. Now you do whatever you want with it. So that attitude is great. The other thing is also, when I say meeting people where they're at, why I called it out separately is meeting internal stakeholders where they're at. Like, okay, you don't understand service design. Come on, let's hang out and talk and like just talk about it. And you tell me about what you do as well. Maybe I don't understand enough of it, right? Versus again being like, you have to include us in this project and you need to tell us every time service design should be included. And we want to lead this, and because we have to. We've learned service design in college. Like that mindset does not work at all, I feel. Um, yeah, so this little bit of a blank slate trait essentially, right, is honestly what has worked best at Noora, versus, and I don't mean that by past experience. I mean that as like a mindset that you can have now. Like, it's okay even if you have gone to a design school. Now when you come into the organization, can you start with a blank slate?
Right, right. So I'm just like reiterating what you said. So the main skill sets, or what you felt was really good in that particular service designer that you identified in Bangladesh was the attitude mostly.
Yeah.
So it was his attitude and his ability to be very grounded and
Yeah.
having that curious, childlike excitement to learn more. I think is
Right.
that. I think soft skills are one of the most highest requirements for service designers rather than hard skills. And people skills, I feel like, is another huge.
100%.
Yeah, if you're not good with people, you will just fail as a service designer. It just wouldn't
Yeah.
work. You can build your service blueprints, you can do your journey maps, but nobody's gonna listen to you.
Yep.
Yeah.
100%.
Would you
Yeah.
say jugaad also comes into play, like you said, that meeting people where they are and kind of
Yeah.
starting from there? So it should come naturally to Indians because it's so intrinsic to
Yeah.
us.
Yeah. I wish that was true all the time, but I agree. I agree in the sense that we actually, I love Jugaad at Noora. Like, I love to do as much Jugaad as possible at Noora, right? Like, so I'm using this word 24/7. But so I agree with you completely. I think I'm only coming from the perspective of, even if we do Jugaad, I don't feel like, and even if like it's so ingrained in our culture, that isn't enough to convince a person or like help them realize that service design is, uh, you know, important. Like, that's the only part that I think would not happen. Like, it wouldn't be enough, but it's definitely on the list of skill sets as part of everything else. But apart from that, also like really taking a zoomed out approach. So I really want to think about systems more, the systems aspect of my title more, the systems aspect of the team's title more, and not just the service aspect. We haven't had the time. Like, when you have everyday ka kaam, you don't really have the bandwidth to zoom out so much that you can like think about what the value of designing within the public health system itself looks like, right?
Mm.
And the other systemic aspects, like what are the other NGOs, what are the other like how do we look like to somebody at the WHO, and because we are advocating for that type of stuff as well. Like the end goal is for family caregiving to be a part of, like to be a policy, right? To be a WHO policy if possible, so that
Mm.
everyone across the world is able to incorporate family caregiving easily. So
Mm.
how can service design support that initiative, right?
So, can you just give a quick overview on what is the difference of a system and a service lens, and why have you decided to shift? And what is that opportunity looking like for system versus service?
Yeah. So we started to call it service and systems about 2 years ago, 2022. And that's because a lot of the work that we ended up doing was thinking of outside the intervention. So one is your typical service blueprint, which is this is the intervention, like this is what the user's experience is, this is what the front stage experience is, this is what the backstage experience is. But that is focused on what Noora does or what the organization does, the service that we are offering. But we were thinking about people and things that exist outside of that blueprint. Like there are multiple other non-profits working. For example, we worked on tuberculosis in 2021, which is only for like a couple of districts in Madhya Pradesh. But one big learning for somebody like me who is not from a public health background was that nutrition plays such a big role in TB, right? And we can say, eat this food, do it correctly, etc., etc. But there is a government policy that exists that gives them free food. It's called Nikshay something Yojana, where they can go get free food if they have TB. They just need to test and then they can go get free food. Now, if we are not pointing them towards that free food, are we actually helping them at all? These people are rural, tribal folk without any like access to this, to even this knowledge. Like literacy rate is so low. How will they find out, right? And even in terms of understanding TB symptoms, to know that I have TB, and then to be like, okay, now it's not stigmatic, so I have to go test it. And then to be like, after I test, I know that I can go collect this. It's a lot. It's a lot in their journey. And we are able to solve only very small parts. Like Noora is able to solve understanding symptoms, like and knowing when to go test. Pushing for, like, we have a little bit of training for the community health officers in that case on, like, if people come to you with stigma related things, like if they're like, I don't want to test because I won't get married, which is definitely a thing in rural parts. Like if I test and find out I had TB, they'll be like, don't want to marry you. So if people come with those problems, how do you tackle that is something that we have done. But if we hadn't looked at the systems aspect, right? Like if we did not know that this, what do you say, if this free food policy thing was available, then we wouldn't have added it to our tools. We wouldn't have communicated about it in our content. And hence, as a result of that, like people wouldn't have maybe, known about it and done it anyway. So that's one. And then I think the other aspect is also things like not clashing with other initiatives. There's so much happening in the public health system. We should only be adding value to things, right? And not being like they're doing something, here are we also doing the same thing, and then people are just confused, like, what do I do? Situation.
So, all of us want to know what was that tip that you have for a lot of us who are figuring this space out.
Meditate.
Meditate.
I'll tell you why. I think that there is a tipping point with service design. You will go through existential crisis. You will go through, like, you'll feel like you're falling off a cliff. Like, you'll be like, oh my God, what am I doing? Why am I here? Do I just want to become a product manager because it's easier and it's almost the same thing? Like, what is the point? But like, and the way to get through that for me was to like be calm. That's why I said meditate. Like be calm. I like illustrate on the side. I like do my own thing that's unrelated to service design. But I also keep myself very, very updated on like articles, and like I bought your book. I have a bunch of other books and articles that I constantly have access to, and like I keep the conversation going, to motivate myself, but also to have other people on board. Like this whole running around and telling people this is service design, this is service design, is also for me. You know, like it's also for me to be able to say, hey, I'm saying this, like what is the reaction like, and having that conversation. This community that we have in India is great, is also really helpful. So like my tip is going to sound cliche as hell, but it is to stay calm and never give up, because that's the bigger fight. I don't think that like everyone knows service design and everyone is able to do service design. Like I don't have any tips there. Skill set is not the problem. It's about like sticking with it.
I wonder if, because you've been working in the public sector, and like you mentioned, service literally means seva, because you're in that space, is that also what keeps you going, because you know you're working for like good of the people and not booking profits in a sense?
100%. That's a great catch. I don't know if I would survive in an organization that, or even in consulting anymore. I don't know if I would survive in a place where I'm not delivering some impact. So continue staying motivated and excited about this work.
It's really humbling to hear that. So, saying that, last final question I want to ask you, is it worth pushing and pursuing for service design? With all this patience and meditation and all of these things that you're doing, is it worth the struggle?
Yes, I would say it is worth it. I have asked this question myself to myself multiple times, but I would say it's worth it. I don't think we need to define ourselves by our title always. I think it's okay to do other things as long as you're practicing service design, right? Sometimes we're very stuck, like, and I've had that problem as well, where we're just stuck on this term and like, I want to be this forever, and like, how can you call me anything else? Um, but it doesn't matter. I think the bigger thing is like actually being able to do the work, and doing it because you enjoy it. So I would say it's worth it 100%. But like when you're looking for jobs, look for places that are open to your methods and your mindsets rather than open to the title. And that's at least my goal going forward. That being said, in 5 years I may not be called a service designer anymore, um, because I want to do like more work in environmental sustainability at some point, more, and stuff like that, or agriculture like you guys are doing at Jiva. um, and often it's hard to find service design roles in these places. They call it very different things. So yeah, but I would still do the same work, I think, or similar work.
It's a mindset and a value system, I think, that we
Yeah.
develop.